Hey everyone, welcome to Confessions of a Former Healthcare Worker. I'm Destiny Pfeiffer, and I started this podcast to educate people who have a desire or who are working in the healthcare field, whether you're working doing home health, personal care, working in a hospital, working at a doctor's office, to even sharing stories about what it was like working during the COVID pandemic. Last time I talked about combative patients, which is if you're working, especially as a nurse aide or as they call it, a PCA, and even as a nurse, doctor, you're going to run into combative patients. Patients who are violent and sometimes either need to be chemically restrained or actually be restrained to the bed, or they also have mitts that they put on for somebody that's especially aggressive. They're like, look almost like little oven mitt type things. I worked with a lot of combative patients. It's a very challenging job and it can be very intense and very scary, especially when you're the one being abused and assaulted by these patients and you can't fight back. I dealt with that a lot. I always dreaded calling in the morning or being pulled to sit with a combative patient because I never knew what I was going to deal with. During the day, sometimes it was a bit easier because they were chemically restrained, so they would often sleep during the day. But the evening shift, I had a few patients who were up all through the night. And when you're sitting in a darkened room with a computer having to document on these patients and chart on them every 15 minutes, it can be a bit intimidating. You have to forgive me. My hair just never lays right. So I figured I would talk a little bit more about what it's like working on the hospital floors. As I said before, I think it's different when you're a patient than when you're actually working taking care of patients. I don't think a lot of people realize what goes on and how busy it can get, especially during the day. If you have 12, 15 patients you're taking care of, you have to immediately after getting reports and it turns like 7 a.m., you have to go to every patient's room. We had to update the dry erase boards, letting the patient know your name and that you were the PCA that's going to be taking care of them. The nurse would have to do the same. And you had to go from every room and do vitals. And there was a lot of people that weren't happy being woke up at 7 in the morning. I don't blame them. There were times when I had people swinging at me or swearing at me, and you really have to just develop a thick skin. It is a position that you have to have a thick skin for. But it can be hard to have that thick skin, especially if something goes wrong. I'm going to talk here in a few minutes about the first time I had a patient code on me, uh, which was really terrifying and really freaked me out. So after you get vitals, the call bells immediately start going off. People have to go up, they have to go to the bathroom, and you find yourself running from room to room trying to make sure that these people are getting to the restroom or seeing what needs to be done. They need moved up in the bed. And it could be a bit overwhelming because on some of the floors they had pagers, they had phones. You'd be getting paged constantly, and you would be in somebody's room doing There were times when I was in somebody's room having to do a complete bed change because the person, had an accident or a lot of times had C. diff. So it's very hard to run from room to room, especially because in the isolation rooms you have to gown up. You had to wear gloves. Sometimes you had to wear like a face shield. It all depended, but you had to be gowned up. You just couldn't run from room to room. You had to remove the PPE stuff that you were wearing properly and dispose of it. Make sure you washed your hands and make sure you sanitized everything down, including if you had to bring the Dynamap in to do the vitals. You had to sanitize so that you didn't run the risk of spreading that to the next patient. So there were many mornings when it could be overwhelming. You had nurses telling you, I need help, this patient needs help, and you just really had to learn how to multitask and help those patients and pray that none of them tried to get up on their own, because you would usually hear the bed alarms. The people that were known to try and get out of bed, we definitely had bed alarms on because we didn't want those patients to fall. And it was often crazy because as a PCA, where you got your report around 6:30 in the morning, the nurses didn't get their reports till about 7:30 in the morning. So they were often busy going from room to room. I'm hoping eventually that I will get some comments, hopefully positive ones, from some nurses explaining how the charge nurse would decide what rooms a certain individual was going to get. Because there were times when, if I was on a certain floor, I was in charge of all the isolation rooms, or times where I was in charge of the patients who were going to be discharged the most. So I would like to eventually have a nurse come on and talk or comment about what it's like for them to get reports. Nurses have it a lot harder because they also have to give medication to these patients, and they have to make sure they're giving the right medication. So there were times when you had to depend on either the other PCAs or you just had to do the best you could. We often worked 3/12s and 12-hour shifts. They could go fast, but in 12 hours, you were expected to get as much done as you could. And that often meant ambulating a patient, because there were many times I dealt with physical therapy. Some of them were very helpful, and then there were a couple that weren't so very nice and would, kind of yell at you if you didn't walk these patients. And what they didn't understand, which is another reason I'm doing this, because I don't think that the physical therapists that went and worked with different patients, I don't think they understood how busy it was for PCAs and nurses to do this, because we were expected to bathe as many patients as we could or get them to the shower. Sometimes we didn't have time to do that. Sometimes we didn't have time to ambulate them because, as I said, sometimes you were running and helping 12, 15 patients. It all decided on whether you were short-staffed, and 90% of the time we were short-staffed. The hardest thing was during lunchtime, sometimes you wouldn't always get a lunch. Now, when you're working 12 hours, a lot of times I would stop at the Starbucks down in the hospital main entrance, and I would get a coffee, like an iced coffee, because I needed the caffeine. You need to be really energized when you're doing that kind of job. And so it was very hard to be able to bathe and ambulate a patient when you had so many call bells going off. You had patients that wanted to stop and talk to you so bad because they were so lonely and they maybe was the only person in their room. And I really did feel for those patients. I wish that I would have had the time to talk to them, but like I said, call bells would be going off, bed alarms. You had to get AccuChecks on those who were diabetic, and you had to make sure that those were done at a certain time. And you had to also make sure that you looked at every single food tray and calculated how much that person ate. Sometimes that didn't always get done, especially if you worked the night shift, because by the time you came in and was getting a report, their trays would already be taken by the dietary people, and you would miss out on calculating how much that person ate. And that would sometimes come back on you. You would get told about that, but you could only do what you could do. I would be lying if I said that I didn't end up with a lot of UTIs because it's very hard to go to the restroom. It's very hard to have one of your fellow PCAs hold your beeper while you went to the restroom because a lot of times they were too busy. So you had to hold it in. And there were many times when I would bring saltine crackers and just try to snack on them whenever I had any sort of downtime at all. Because a lot of times you didn't have time, especially if the higher ups decided to do meetings, which made it very, very difficult because there was a lot of trial and error going on when I was a PCA, where the higher up people wanted us all to get together at the nurse's station to give individual reports on our patients. And what I hated about that was there was nobody watching out for the patient. There was nobody keeping an eye on the patients. And I was actively terrified. I hated that. And I remember us PCAs really trying to fight against that because somebody had to watch the patients to keep them from getting out of bed and falling and getting hurt. We had a lot of RRTs that it did occur. I dealt with those RRTs. Ended up because I had so many patients trying to get out of bed. You kind of have to use your body to kind of help them gently get to the floor. However, it doesn't always work that way. So in the end, I ended up really tearing up my back to the point where I live in extreme pain on a daily basis. I have to get shots in my back. And it has messed up my entire body. Because, like I said, there were sometimes patients couldn't move themselves up in bed. They needed help. And if the nurses were busy and the other PCAs were, you kind of had to try and get them up yourself. And sometimes these patients were to assist. I remember having a few patients who were very obese, and I'm talking like 300 pounds or more. And that was a really big challenge, trying to help that person get moved up in bed without any help. And that really did a number on my physical health. And dealing with combative patients, sometimes dealing with angry ones or ones that were very, very sick, it does take a toll mentally as well. The first time I had a patient code on me, I had been working the day shifts, but I decided to work a night shift. You had that opportunity to pick up an extra shift and you would get paid time and a half. And at the time I was making $15 an hour, so time and a half was pretty good, especially for someone like me who has been doing the single mom thing for 18 years now, I would depend on that money uh, to keep a roof over my head and my son's head. And I remember it started out being an okay night, and one of my patients, I was told that she was very epileptic. Sorry, I'm gonna mispronounce, but she took grand mal seizures, and I was warned that she could be very gruff and want to start fights, but with me, she didn't do that. With me, she was very kind because I was kind to her. And I remember she had to go to the restroom, and I took her to the restroom. Forgive me. And I had a hold of her, and she kept saying, "I feel like I'm going to go boom boom." And she had some intellectual delays, and so you really had to pay attention. And I was like, "What do you mean you feel like you're going to go boom boom?" And she says, "I feel like my head is starting to hurt and I'm scared." And the nurse came and we got her back in the bed. But then she rang again. She had to go to the restroom again. And this time there was nobody to help me. And so I was trying to get her to the restroom when all of a sudden she started taking a seizure. And I had to gently get her to the ground. It was very scary. I had to hold her hand and I started screaming for help because I wasn't anywhere near the call bell. Her roommate had like dementia. So all I could do was yell for help, and the nurses came in and they got her on a backboard. They call it RRT, Rapid Response Team. And we got her on the backboard. We got her back into bed. The doctor came in, prescribed her medicine for her seizures. We thought we had it under control. Um, about an hour or two later, if even that, I was somebody was screaming for me to come into the room. I, along with her nurse, we went running in, and she was taking another seizure. And I remember she grabbed a hold of my hand, and it was really truly a frightening experience for me because I had never seen a patient. Sorry. I had never had a patient code on me before. So I remember feeling terrified because they called code gray on her. And her teeth were clenched together. I do apologize for the shakiness of my camera. But she stopped breathing. And I remember seeing the doctors trying to get her back, and they couldn't find a pulse. So I was literally stuck in this room because when somebody codes, they called code blue. When somebody codes, all the doctors, everyone come rushing in, and you're pinned. I was literally pinned against the wall. I was trying to calm down her roommate who was kind of freaking out, and we were waiting for the helicopter to come in and take the woman to Pittsburgh. They were going to fly her down to Pittsburgh. They got a pulse back, and I remember watching their respiratory team. They stuck a ventilator down her throat to try and help her breathe. But I remember learning that she never made it to Pittsburgh. She passed on the way. And it was I was shook up all night long. And there was a part of me that wanted to cry. I mean, this was my patient, and she had just coded. I mean, I just had talked to her. She was being so nice to me, and I had stepped away because I had to go get samples, urine samples from a patient and send them to the lab. Her nurse had stepped away because she was checking on our patient, and it just suddenly happened. It was so fast. And there are times when I often think about that woman. Um, I know that there was nothing I could do to save her, and it was truly heartbroken. I was really heartbroken over that. That was the first time I had a patient code on me. I remember working on the other floors and having to give one patient her last bath. She was this really sweet woman, had a loving husband, a loving family. They had all came in because they were told that she was dying. And all I could do was make sure that everyone was, taken care of. There wasn't much I could do for her except keep checking because she was very diabetic. So she had developed cuts on her arms and legs, and she was like there was fluid coming out. And I was told that she wasn't expected to make it to morning. So I had to give her last bath, which she thanked me for. And it was very sad. And I remember asking her husband, "Is there anything I could do?" And he's like, "No." He's like, the love of my life is going to die. There's nothing that anyone can do at this moment." And I felt just so bad. But that is something that you definitely have to expect if you decide to become a PCA or a nurse and you're working on the floors of a hospital. You do have to learn how to deal with code grays, code blues, and patients who are actively dying. And I'm going to finish that up today. I'm trying to keep these at 25 minutes. And I apologize if I was a bit shaky before. My cat is not feeling well, so I had to kind of go and let my poor cat out. She's just not feeling well today. So I do apologize for any shakiness, and I do welcome anyone who is a nurse or who works in the healthcare industry to please share your experiences so that other people who are going into that field or who take a job working in a hospital knows what to expect so that they're not going in blind. Because I went in blind. I had no idea what to expect as a PCA. 1 week of class does not prepare you for actually working the floors, actually working one-on-one with these patients. And it most certainly does not prepare you for working with ones who are combative, ones who are on hospice more or less because they're dying. And it can be very hard, especially if you get to know people. And in my next video, which I hope to do here shortly, I am going to talk about my move from being in a float pool to working in the rehab department of the hospital. And that is a whole other story in itself, because the routine is different, but you sadly do deal with patients who do pass away or who are combative, even in the rehab unit. So I hope that you could forgive my shakiness, and I hope that you just learned something today about working in the healthcare field and exactly what to expect. And I intend to keep sharing my stories and sharing about the routines and try to help as many of you as I possibly can. So tune in next time. This is Destiny from Confessions of a Healthcare Worker. Thank you. Bye.